Nobody likes to dwell on the subject of death, but in the past 40 years, the subjects of death and dying have been slowly changing in America. Prior to hospice, often people died alone in institutions like hospitals. Now, many are choosing to receive palliative care at home as a way to make the end of their lives as comfortable and rewarding as possible. But there are still many misconceptions about hospice care. The healthcare professionals at Cornerstone Hospice explain the services they offer and how misconceptions should not keep you or your loved one from utilizing their specialized care.
Each year, more than 6,000 patients call upon Cornerstone for care. We come in and we assess what's going on with the patient and the family, and we design an individualized plan of care, and then update that plan of care as time goes by. We update it every couple of weeks. When folks think of Cornerstone Hospice, what they really need to know is that the scope of services we provide is designed to meet all of the needs of the patient who's facing the end of life. A lot of times folks think that they define us by what they think they have to give up, but they don't really realize that when a patient comes under our care, in addition to the nursing visits that we provide and CNA visits, we also have physicians who can make house calls, and then all of the medications, the equipment, and affiliated services like chaplains and volunteers, all that's included as part of the hospice benefit. Another myth that folks have is that when they come on hospice care, it means that they just have hours or a few days left, that there's going to be some immediate end to their life. And what we let folks know is that the hospice benefit is designed for the last few months of life, ideally. Because if we just wait till the last couple of days, that really isn't enough time to help someone prepare for all the things that are going to be happening. And so if you look in the sense of the Medicare benefit, that's 6 months or less of life expectancy. But actually in Florida, the state law is that we can admit patients with a year or less life expectancy. And actually what we find over and over, we hear families who've benefited from our service, and they say, you know, we wish we'd have learned about you guys sooner. We wish we'd have made this decision earlier. We could have had all of that support for a longer period, and this experience it was good, but it would have been even better. And so part of our message that we're trying to get out to the community is have the conversation, help folks understand in your family what you want, what you don't want at the end of life, and make those preparations in advance and get access to the services earlier so that you can spend as much time saying goodbye and gathering your friends and loved ones around and make the most of the time that you do have, however long that is.
Be sure to join Cornerstone Hospice for the 6th annual Spice It Up for Hospice Chili Cook-Off on January 30th in downtown Bushnell from 11 a.m. to 1 p.m. You'll get to try some of the best chili in the South, all in the name of charity. This year's event will host 20 different chili teams and rock out to the tasty tunes of Todd Brown and the River Junction Band. To find out more about hospice and the palliative care services available at Cornerstone, follow the special care story link on our homepage, yourhometownhealth.com.